Child health is of extreme importance, and there has been many strategies formed by the Education Department, government and schools implemented to assure major issues are addressed. These issues include obesity, asthma, and mental illness. It has been noted in studies that these issues need to be managed as early as possible so that further health concerns in later life are minimised. Obesity is a very prevalent problem in Australia. Media, health experts, and researchers talk about this condition becoming an epidemic, and it is now recognised as a principal childhood health concern. The main influential environment for children is in their home. Studies have shown that parenting behaviours have little association of higher odds of obesity, but it is important to know the causes of obesity and what effects it has on our children, as almost a quarter of Australian children aged between 2 and 17 years are currently overweight or obese. Many factors influence weight and obesity. It mainly occurs due to an imbalance between energy intake and expenditure. Other factors include genetics and environmental influences. In short, our children are eating more food, creating more energy than they are able to use up. With declining amounts of exercise, with the increase in technologies, the importance of looking at healthy meals and snacking options has never been greater. This comes down to creating a sustainable, healthy environment at home. Ask yourself the question, what does your child see as soon as they open the fridge or the pantry? And consider the high sugar contents of a lot of common drinks such as juice and cordial. Wojcicki and Heyman's study in 2012 demonstrated that high intakes of juice is associated with increased risk of obesity. Children eat with the same dispositions as adults. We eat as a source of energy, to cope with stress, or just as something to do. Other factors include parental obesity, low socioeconomic households, genetic or hormone disorders, regularity of sleeping patterns, and also medications can increase appetite. So how do all these contributing factors affect your child in terms of obesity? Obesity affects the whole body and has long-term effects on children. Blood flow is restricted, resulting in possibilities of high blood pressure, coronary heart disease, and stroke. Other risks include type 2 diabetes, cancers, high cholesterol, liver and gallbladder disease, breaking cartilage and bones within joints, abnormal periods, and infertility. It is an issue that revolves around everyday life and one that needs intervention early to reduce its effects. Asthma is a chronic disease of the respiratory system, or airways. Around 6 million Australians across all age groups have a long-term respiratory illness. And in 2007 to 2008, 10% of all men and women reported that they had asthma, though thankfully the prevalence of asthma among children has decreased over the past decade. And many children will actually grow out of it in later life. The underlying cause of asthma is still a scientific mystery, but it is noted that if there is a family history, it is more likely to develop. It does, however, have many triggers. These include colds, smoking, inhaled allergens, strong odours or scents, cold air, or changes in temperature, certain drugs, food preservatives, and exercise. So it is important that with any child with asthma, the main triggers are noted so that they can be monitored by caretakers. It is also significant to note that though exercise can be a trigger, the other end of the scale, obesity, can also contribute negatively to asthma. Consulting your family doctor is very important in preventing attacks and learning how to best manage and treat this condition. The triggers mentioned can have effects which are easily managed, such as coughing, wheezing, fatigue, hyperventilating, pale and sweaty skin, difficulty sleeping. Asthma plans are essential as the conditions make it very hard to breathe and push oxygen around the body, and not knowing how to manage this illness could lead to death. Long-term asthma can also initiate other respiratory diseases, tissue scarring, pneumonia due to increased mucus buildup and swelling of small airways. Mental health is a state of coping, feeling good and being in control of your life. It is when negative feelings persist and overwhelm that mental health comes into question. Until recently, the impact of mental illness was underestimated, and in Australia, 6.2% of children under the age of 15 suffered from long-term mental or behavioural issues, making it a national health priority because of the extent of its impact and because it is possible to reduce through prevention and treatment. It comes in many forms: anxiety, bipolar, eating disorders, depression, and schizophrenia. Mental illness is caused by several factors: trauma, stress, and it is hereditary in some cases. Some mental disorders are also linked to chemical deficiencies in the brain. In children, the main factor is stress and anxiety. Rapid changes happen for children no matter what socio-economic group they come from. Divorce, starting school, moving house, all play a normal part in life. Personality defines how children cope with these changes or multiples of change. Putting in management strategies to help children learn to work through the events happening to or around them is key to healthy mental development. Mental illness has many effects. Stress can create physical illness in response such as headaches, high blood pressure, and ulcers. It can also form into disorders such as bulimia and anorexia. Physical effect indicators include fatigue, irregular sleep patterns, weight loss or gain, self-harm, skin conditions. It can also affect mood, normal patterns of the person's life, leading them to alcohol or drug abuse, even violence. The worst effect of all is death, primarily by suicide. Thankfully, studies show that suicide levels are low in the 0 to 14 age group. However, the risk increases as children get older, so taking preventative measures is essential. Children are creative and play-based, so are essentially quite active in everyday life. Physical activity has so many benefits and is not hard to encourage and model for children. It stimulates physical and cognitive development, keeps children at a healthy weight, gives them less chance of having high blood pressure or obtaining type 2 diabetes. There is also a very positive effect on children's moods and sleeping patterns. Get Set for Life, Habits for Healthy Kids Guide promotes exercise and works with schools and communities to make sure our children are healthy in every way. Physical activity can mean independent achievement and teamwork. Playing sports, riding bikes as a family, or walking the dog are all activities that stimulate a sense of being, belonging, and becoming. It builds self-confidence and identity, as well as promoting social development by fostering communication skills with peers and adults, and stimulates cooperation and leadership skills. Being able to move in the outdoor and engage in vigorous play is a healthy release and nurtures a general sense of well-being. Physical activity stimulates cognitive and emotional development, and education plays a large role in modeling these benefits. Physical education in schools is extremely important because it is the best way to reach out to virtually all children. Schools are able to guide children through the patterns, causes, and effects of everything we do in everyday life, providing them with their sense of being, belonging, and becoming. It also provides children the beginnings of their independence as they learn the skills to later implement themselves. Programs that assist schools in implementing these skills are Healthy Harold, Get Set for Life, Healthy Kids, and Life Education. For example, Healthy Kids programs offer ideas for schools to provide kids with healthy tips such as Crunch and Sip, where they have a set time to eat fruit, salad, or vegetables in class, or Jump Rope for Heart, which teaches children how to keep fit and healthy while having fun. Teachers are trained from university about how children develop and the best methods of supporting them through their development. Teacher development continues after university with training regarding the latest discoveries and new ideas to further implement within and outside of the classroom. These courses include working with families, behavioural disorders, learning difficulties, physical impairments, among others. The New South Wales Department of Education requires teachers to continue their own education throughout their career, and it is essential that teachers have the skills to teach and implement health strategies in and out of the classroom. as it enables them to observe their students and in some cases help identify any health or physiological issues. The best combination is always teachers working with parents to note any concerns and help to assist in maintaining good health both physically and mentally. Teachers can identify a lot of easily in a school setting, such as restlessness and poor social skills. Physical activity is essential for both social, physical, and mental skills. Schools that encourage physical activity find that their children are more focused and able to achieve their best in their academic skills. Guiding children through physical activity enhances their fundamental movement skills and builds them towards a brighter future.